On the back of that, let's bring in OCTA Research Fellow Guido David to help us make sense of all these numbers and what's going to happen. Professor Guido, good afternoon. Thanks for coming back on. How do you think the IATF will be deciding on quarantine, and how will today's COVID-19 numbers factor in almost 14,900 cases?
Well, Sean, I don't think the today's number will really will factor in that much. I think they have probably made their decision already based on the trends over the past 2 weeks, and based on what they are foreseeing to be the trends over the next 2 weeks. I mean, whatever the case may be, yes, whether they extend ECQ or whether they move down to MECQ, I think both will be fine recommendations, as long as, the MECQ should still be fairly stringent in that, we don't allow social gatherings at this time, and, many other activities. So I think the mobility change between ECQ and a fairly strict MECQ would not be that significant. It will still affect the numbers, but we think it would be fine either way.
Right. So should we actually expect a further increase in cases in the coming days? For those that are numbers conscious, we're already hitting, the second highest tally for how many days now this week. You think then it's safe to say that we will actually log the highest number of cases since the start of the pandemic in the next couple of days or weeks?
Well, Sean, let's put it this way. The reproduction number has been decreasing. In the Philippines, it's 1.46. And in the NCR, it's 1.7. But even with the decrease in reproduction number, it means that cases are still increasing. That means we will likely see, the record number of cases being broken sometime, probably by next week. It could even happen this week. But that shouldn't mean that the lockdown or the quarantine restrictions are not having their effect, because as was noted by the spokesperson, the effects of the lockdown will be felt usually after 4 weeks, in the sense that we will see a downward trend after the 4th week. So by our estimates, this would be around mid-September, about the 2nd week of September, when we will see a downward trend.
All right, so we should expect, at least hope for, a decrease in cases by the 2nd week of September because of that delay of the effectivity or efficacy of quarantines. Now, when we talk about other provinces that are also experiencing a surge, such as Bataan, Laguna, Cavite, and others, do you have any quarantine classification recommendations for these specific areas?
Well, I think they have to implement their quarantine protocols strictly, and have people abide by the minimum health standards, because cases are still rising in many provinces. I mean, as I mentioned just a while ago, the trend has slowed down a little bit in Metro Manila, but not in the provinces, in Cavite and Laguna. I mean, Cavite is still accelerating. And that will actually help drive the numbers up even further. And that's why we're expecting to see, more than 15,000 sometime by next week. I mean, we're not trying to be alarmist. That's what the projection says. So, but it's really mostly in these areas, because we just published a report today that says that in Cebu City, we're seeing a slowdown of the trend. And we're hoping that, or we're expecting that by the 1st week of September, that the cases will be on a downward trend. But not in Cavite, Laguna, and in other areas in Calabarzon and Central Luzon. I mean, we're still seeing the upward trend. So we'll have to look at the numbers and monitor them and see if, we'll start to see a downward trend in some of these areas.
All right. Having said all of that already, are there any other provinces or areas or regions that the government should be keeping an eye on as early as now?
Right. Well, like I mentioned, in Central Visayas, the situation is improving, and we expect it to, to be improved by September. In Mindanao, there's still some slight increase in cases in some areas, like again the Ora and Davao City. But I think the situation is fairly stable and fairly controlled. In the Ilocos region, it's also controlled now. The cases are starting to decrease. So it's mainly NCR Calabarzon, Central Luzon, and I guess Cagayan, Tuguegarao, where we're seeing a spike in cases. It actually has the highest attack rate based on our report a few days ago. So it has the highest attack rate in the country. And I think those are the places that we have to be concerned about, because in other areas in Western Visayas, situation has already improved. Even in Aklan, it's stabilizing. So just those areas. I mean, the fewer areas, Sean, the better, of course.
All right, thank you so much, as usual, for your time. We appreciate it. Professor Guido David of the OCTA Research Group over the phone. Thank you, Prof.
Thank you, Sean.